Thank you very much for the introduction, and thank you everybody for joining us. I will share my screen and I will go ahead start my presentation today regarding the current situation and challenges, what's happening in the prosthetics and orthotics in Gaza, inside Gaza and outside for the Gazans who were evacuated outside of Gaza. So the title of my presentation is Prioritizing Prosthetics and Orthotics for Injured Gazans. And the reason I chose the word prioritizing is that, through the different, medical conditions that the Gazans are suffering from amputations and others and so on, prosthetics is the one that is, big numbers of amputees are, getting the amputations inside Gaza because of the war. And this is unprecedented, actually. We have seen big numbers of amputees in earthquakes and so on. But with the war in Gaza, the number of amputations is quite high, especially in children as well. I think some statistics show that the children amputee in Gaza is the highest in the world so far. Before I start my presentation, I just want to mention that I am an independent freelance P&O trainer, P&O prosthetics and orthotics, and I do not represent any organization in this presentation, although we were sponsored by Lady Zainab Foundation in Cairo last week, and I will show some cases which we have seen in Cairo of last week. My presentation will be mainly in 5 parts. The first part, I will talk about the status of prosthetics and orthotics inside Gaza. The second part will be the P&O for disabled Gazans outside of Gaza, like in Egypt and other countries. The third part will be the challenges faced with prosthetic and orthotic service provision. And then the advanced prosthetics that Ala just mentioned, which our amputees deserve to have the best prostheses. And then finally, what are the steps needed to prioritize P&O services and what is important at the current time. For the status of the P&O services inside Gaza, even before the war started, I'm talking about this war, the P&O centers were not staffed, enough. I was involved in the training of the P&O technicians for several years, and it was always a challenge to reach them, to train them, and even we tried at some times to get them out of Gaza to join us in trainings in Egypt and Turkey, and it was very hard to get the permit for them to do the training with us. So to start with, the P&O centers were understaffed before the war, and you can imagine what happens now with the influx of high numbers of amputees during the war. So right now, during the war inside Gaza, which organizations are active in providing P&O services? The Royal Medical Services from Jordan, belonging to the Royal Jordanian Army, are the first ones who were able to enter Gaza with 2 mobile units, providing the prosthetic and orthotics, mainly prosthetics actually, not much of orthotics. And the difference between prosthetics and orthotics is that prosthetics is for amputees, whereas orthotics is people who did not suffer amputation, but require a device to stabilize their limb, for example, their leg or their arm and so on. So they don't have an amputation, but they require a device to stabilize their limbs. So the Royal Medical Services entered 2 mobile clinics, but they were not really mobile. They were stationary, and patients who needed the service came to them, and they were serving them with ready-made or almost ready-made sockets made by a UK company, Amparo, that made it possible for them to provide the service on the same day. Usually in prosthetics and orthotics, you need several visits to get your prostheses. So on the first visit, it is an evaluation and maybe molding or casting. Second visit, it will be a trial of the prostheses. And on the third one, at least 3 visits. On the third one, you will receive the prosthesis and the training. So these people were able to do that in one day, and I will explain the reason at the end why it was done that way. The artificial limb polio center, which belonged to the Ministry of Health in Gaza, they tried to stay active during the war, but they had a shortage of materials, and also their staff were not around because some of them had to move along with the people who were evacuated from one part of Gaza to the other part, and so on. In our last connection with them, they are trying to reestablish the services at ALPC, and hopefully they will be able to do that very soon. The International Red Cross also tried for many months to enter also some other mobile units inside. It took them a while. I think they managed to enter a little bit of what they wanted to do, and they are mainly fitting lower limb prosthetics with the basic prostheses. The Humanity and Inclusion is another big organization, worldwide organization. They are also trying to help the Gazans. They sent a team into Gaza, but mainly it was a physiotherapist and another, I believe, a nurse, but not a prosthetic and orthotic technician. So their hope is that they can establish a service within Gaza with a 3D printing, which in itself is a challenge as well. I'll talk about that later on. So the current challenges is the shortage of skilled technicians inside Gaza. What about outside of Gaza? As you have known, many patients evacuated from Gaza outside into the neighboring countries and other countries as well. Many of them went to Egypt and Jordan, but some of them were also taken into Qatar, and they were really served well with the prostheses and the other medical, rehabilitation that they wanted. Some of them went to Turkey. Some were taken by organizations, NGOs, to Europe and the USA. There are several NGOs involved in the provision of prosthetics, and if you go on the social media and you listen or you watch the videos that they have put out there, you can see that most of the NGOs are talking about the prosthetics. Very few of them will talk about orthotics, because orthotics to them is more attractive. It's more attractive to to the people who donate and so on. And this in itself is something that we will talk about. I'll talk about it at the end of the presentation. What we aim to is to safeguard against fraud that can happen, and it is happening. Actually, we have documented at least 1 or 2 incidents of NGOs collecting a lot of money for the benefit of the patients, but actually what happens is that the patients will get very little money for their prostheses, and then who knows where the rest of the money goes. So exploiting the patient is happening. It happened in every war. It happened in many places. But again, it is something that we need to shed light on to prevent it from happening. The last part is the patient awareness. The people who were amputated for the first time, for example, they have no knowledge at all about prostheses, and then they can be fooled by anybody and say, okay, this is the best prosthesis for your situation, and so on. If the prosthesis is not fitting well, then it is always the patient that is suffering from that, and it is the patient's fault. This is what we have seen actually in some of the practices. So last week, Dr. Hiba, who will be the next speaker, and myself went to Cairo on behalf of Lady Zainab Foundation from the UK charity to evaluate some of the patients who we sponsored for their prostheses, and to see also new patients. So I will be presenting now a few cases that we have seen last week. This lady received her prostheses about several months ago, And because of the shrinking of her stump or the residual limb, they had to pad the liner, which is this part here that goes on the limb, and then the prosthesis goes on top of that. So they had to line it from inside each time she was losing volume, which is normal because she's a new amputee. Then they had to pad inside until the thickness of the wall of the liner here is about 1.5 centimeters, which means very soon she will need a replacement. This is one of the things that Ala in the introduction mentioned, that the patients who receive the prosthesis, not only they need one prosthesis in their lifetime, but actually they will need many, and then they will need a lot of adjustments and a lot of changes to be made for the prosthesis. So we recommended that she will have a replacement of the socket soon, and hopefully she will get that. The second case that we have seen in Cairo as well is this young lady. She has a Pirogov amputation, which is the amputation of most of the foot itself, but the heel is still there present. This in itself is a challenge. Usually with long amputations like these, there are many challenges. But this lady, we also sponsored her for one prosthesis, and she was not wearing it. And she went to another organization. She got another prosthesis and she tried it. And she got to a third NGO. She tried a third prosthesis. And in 1 year, she had 4 prostheses. That's a lot of prostheses for one person in 1 year. Because she didn't know that a prosthesis can be adjusted. So anytime she was not comfortable with her prosthesis, she went to another place and then she got a prosthesis with a different design. Unfortunately, even this one that I'm holding with my hands here is not the correct design for her, but that's not the biggest problem. The biggest problem actually, and Dr. Hiba will talk more about this case, is that she had many problems around the scar tissue here. And no matter what type of prosthesis we put on her, she will, she will have that problem with any prosthesis. So we recommended for her revision so she can get rid of the problems that she has around here, and she will have a better stump or residual limb to be fitted with a prosthesis. The case number 3 is this young boy here with bilateral above knee amputation, and Dr. Hiba and myself examining him, and he has a problem on the lateral side of his left amputation. So we recommended for him a pad, a special pad to be added inside the socket. These small things that we see when we see the patient and evaluate the patient firsthand is make a lot of difference. You know, a prosthesis can be made by anybody, but the little things that we pay attention to is the ones that make the big changes, the big difference in the success of the prosthesis or not. Funny with this boy is that he came to the center that, like Ala mentioned, that he thought he will come in, get the prosthesis off the shelf, and then leave home with with them. He didn't know that they had to go through a process of fitting with the casting, molding, design of the prosthesis, manufacturing of the prosthesis, and then the fitting and the the training on that. So we recommended for him what he need to be fitted with. This case here, case number 4, he has a big challenge because he had many scar tissue on his skin around the amputation site, and he definitely needed a silicone liner or gel liner actually, and that's what we recommended for him. So again, evaluating the patient, with both of us, Dr. Hiba from the medical side, myself from the prosthetic side, we can always mention to the patient and to the caregivers or the funders what would be the best type of prosthesis that they can be fitted with. Case number 5 is a patient. He is not an amputee. He's an amputee on one side, short amputation on the left side, but on the right side, he had a contracture of the plantar flexors. So his ankle is almost fused with very little range of motion. And he was walking without any device. On the left side, he was fitted with the prosthesis that he couldn't use. The prosthesis looked very good, but it wasn't functional, and it wasn't really to his case. So we saw him on Monday of last week, and on Wednesday, we fitted him with an AFO on the right side, an ankle foot orthosis with a 4 centimeter heel lift, so he can touch the ground and have a better range of motion in the ankle. On the left side, we also fitted with an AFO, simple AFO with an extension here and the toe filler. And then this area here where he had a lot of problems as well, we kept it open so he does not have to worry about that. With the first prosthesis he was fitted, he wasn't able to walk. But with this prosthesis, within half an hour, he took off around outside the center where we were. And then he was walking, as you can see with this. Okay, so he's very functional, and as I mentioned, he took his crutches and then went outside the center, and he was walking very happy. Within half an hour, he was walking, and he really wanted to experience the walking, which he missed. Case number 6 is a spinal cord injury, a young boy who came in a wheelchair, and when we were evaluating him, I told him to stand, and he was looking at me strange. Am I stupid or what? Because he's, in his reflection, he said, "Okay, can't you see I'm in a wheelchair? I cannot stand." And I asked him to stand again, and asked 2 people to support him standing. For the first time in 1 year, the boy was standing when we did not start, making the orthoses for him. I wanted him to experience standing, without the orthoses. Then we evaluated fully with Dr. Hiba, and then we decided that we can fit him with an HKAFO, hip, knee, ankle, foot orthosis on the right side because very weak, no muscles at all. And on the left side, we fitted him with the ground reaction AFO. And in 2 days, so we measured him on Monday, and then on Wednesday he took his first steps for 1 year. He never thought that he would be able to walk again, but this is him after a little bit of training. This is inside the center, but I think he never imagined that he can do this in his life. So just imagine that he never had the chance to be fitted with these. He would be sitting in his wheelchair for the rest of his life. This is the last case we saw there. We did not fit her with the prosthesis. The prosthesis was made in Turkey for her, but I'm putting these pictures of this case to show what happens after 1 year of amputation in children. This is a transhumeral amputation, very short. So the humerus, which is this bone, upper bone here, is still there. And you can see this was an amputation about several months ago, I think 1 year ago. And then the bony growth here, you can see that the bone grew more than the muscles, which is normal. Usually the bone will grow faster than the muscles. And then what will happen is that you will see the bone sticking out from the skin right there. Now, when we fit such cases with the bone sticking out of the skin without padding of the muscles around, a special adaptation should be taken care of. And this is why, the girl, she need more than one prosthesis as she grow. And then as Ala mentioned also in the introduction, that we also want to follow up on the long term with these people, so they will be benefiting from their prosthesis for a long time. Many challenges with providing prosthetics and orthotics inside and outside Gaza. Inside Gaza, accessibility to P&O services is very, very hard. And as one doctor mentioned to us one time, that the prosthesis usually in many countries is a device that a person will use for mobility, for functioning, to go around the house and so on. But in Gaza, it's different. It is a survival kit, which means when the food truck comes and you don't have a prosthesis to walk on to go to the food truck and get some food for you and your family, then you will suffer a lot. So it is very important for people inside Gaza to get their prostheses. The other obstacle that we are facing a lot is bringing prosthetic and orthotic materials inside Gaza because of the embargo on the dual usage materials, especially that we use some metals in the prostheses. But luckily, the Royal Medical Services, as I mentioned before, were able to bring in some, and the ICRC, the Red Cross, is also bringing in some, but not enough. Of course, we need a lot more in there. The different problems that we have seen outside of Gaza is the ill-fitting prostheses. We've heard about cases, we have seen some cases, we evaluated some cases who received their prostheses, but they were not fitting well. Because sometimes of minor things that need to be adjusted, but nobody knew what these things were. I was surprised. One of the patients I saw in Cairo also, he needed just a little bit of adjustment under the ischium or the ischial ramus, and he was fine when I made it a minor adjustment for him. But before, he was not comfortable. So sometimes small things make a big difference. Volumetric changes, when the sump is shrinking, that will require a lot of changes. And then, of course, like in case 7 that I showed in the earlier slide, the growing children who will need new prostheses every now and then. There are many psychological factors, and that Dr. Hiba, I think, will be talking about, and the PTSD as well. There are many NGOs concentrating on prosthetics. I mentioned that, and no long-term follow-up. Advanced prosthetics, yes, we want to fit myoelectrics, but we don't want to fit, for example, for the lower limb, the microprocessor knees, and so on. We want to have the mid-level technology fitted on the patients. 3D printing solutions is not an option right now, because we cannot bring a 3D printer inside Gaza, and to print the sockets outside and to bring them in is also a big challenge. We need to evaluate each patient and find the true needs of that patient, not what they want, because they go on the social media, they look at these nice prostheses, and they think they can be fitted with. So it is very important for the team to always look at the true needs of the patient. Prioritizing P&O services, I don't want to go through all of them, but one of the major things that we want to work with is the training of the staff inside Gaza. And with the Wings of Hope, we are working on remote training that will happen soon, I hope. And then we will look after that. If that is successful, we will look into the capacity building for on-site as well, remotely. But the best solution would be the long-term solution, which is the P&O, the university degree with the blended learning. Hopefully, we can do that. Providing professional service, is that what we aim for? And I believe together we can. Thank you.